If you're just joining us, this is Breakfast Daily, and right now we are jumping into the health segment, about to look at a topic that affects us all, young, old, rich, and poor. Today, we're going to be talking about respiratory tract infections. And of course, joining us is Dr. Kelvin Owusu, a wellness consultant at Violet Medical Center. Violet. Too much Twitter. It's not good. Violence. Too much Twitter. Too much Twitter.
Well,
yeah.
We love you just the same.
Yeah. Don't worry, I'm not violent. But you're welcome, Doc.
Thank you, and good to have you back as well. It's been a while.
Don't be saying that. It wasn't just my week. It was my week off. You know, he's acting like I traveled.
Well, he likes to do those type of things.
No, but it's good. You see, wellness means you have to take a break every now and then go and refresh yourself and come back. So yeah. It's good.
Yeah. How are you though?
Very well, very, very well.
All right, so let's get into it. Respiratory tract infection.
Yes.
What do we need to know about this?
Well, I mean, is there anyone who has not had one before, or should I say this year? It's one of those things it's one of the most common infections or situations that we find ourselves in. In fact, our OPDs, if you take malaria, I think the next big block of diseases that we treat a lot in our OPDs is actually respiratory related infections. So it's very common, and it's also seasonal. You typically when it begins to rain, you get respiratory tract infections, and this year, well, I don't know if I'm alone, but I think it's rained quite a lot this year. Yeah. So it's not surprising.
Even in the seasons when it was not typically rainy season.
Exactly.
Right.
And also, I must also add that there has been a slight change in the trend of the respiratory tract infections because of the academic calendar change. You see, because typically it's the children who go and share the goodies, and then exactly, and then they bring it home, and then the home people will now catch it. So usually you'd have a downtrend during the vacations, and then an uptrend when school resumes. But now because the calendar has changed, it also sort of changed the whole cycle of respiratory tract infections. But yeah, it's still with us, and I dare say everybody has got some exposure this year.
Yeah. Okay, sorry.
Walk us through the kinds of typical respiratory tract infections we're talking about.
All right, so first of all, the respiratory system, from our primary school day, we know that it starts from the nose and mouth. So we call it the nose and mouth kind of come together in the pharynx. So we have the oropharynx and the nasopharynx. All that is kind of part of the respiratory system. We have the sinuses, somewhere beneath the cheekbones, also forming part of the system. And then it goes into the airway, the windpipe, or what's it called? The windpipe, and then it travels down into the bronchioles, into the lungs, and the whole purpose is to exchange oxygen for carbon dioxide. So we live on oxygen, we excrete carbon dioxide. So we generally have two broad groups of respiratory tract infections. There's the upper respiratory and then the lower respiratory. The lower respiratory, we tend to give it more specific names like bronchitis, like pneumonias, all those things. Whereas the upper respiratory, we can kind of lump them all together and just call it upper respiratory tract infections. The commonest cause, or the most common cause, is usually viral, which is to say that there's really no treatment. And so most of the time, people come to the hospital with various, symptoms, headaches, running nose, cough, and then the doctors typically refuse to give them antibiotics. And then some of the parents will get upset, why are you not giving me antibiotic? And they'll go and buy their own antibiotic, and further propagate the antibiotic resistance that we are trying to avoid. Yeah. And the reason why most of the time we don't give antibiotics is because it is not the commonest cause of upper respiratory tract. The commonest cause, like I said, is viral. And so most viral infections, as we learned from COVID, are self-limiting. That is if it doesn't take you away before then. So we try to give supportive treatment. So if there's cough, you would get a cough mixture. If there's fever, you get an antipyretic like paracetamol or brufen, typically. If there's any other thing, we'll treat the symptoms. But the main cause, which is the virus, there's really nothing to give.
Okay.
If, however, however, sometimes the viral infection might be complicated by a superimposing bacterial infection. That is when we'll give you an antibiotic. But generally, if you came in with just a cough and the suspicion is a common cold, because you do a full blood count and you can see the parameters and it's not a bacterial infection, we would not give you an antibiotic. So please bear with us. Let's help bring down the antibiotic resistance, because it's getting more and more expensive to treat disease because of that phenomenon.
Okay. Now, when you say it's self-limiting,
The viral ones are self-limiting.
Yes. When you say self-limiting, what's the period we are looking at?
All right, so this is actually one of the things we joke about in medical school, that whether you take medicine or not, cold will last between 10 to 14 days.
Okay.
So whether you go to hospital or you don't go to hospital, if the symptoms are not too severe and you can manage yourself at home, it will usually last about 14 days and then you'll be back to full fitness.
Okay.
So that's the general trend.
Okay, so 10 to 14 days. What should you be doing in that period? If you have a viral infection, what should you be doing if you're not taking antibiotics? Because you see, I'm thinking about our typical viewer who is saying that, look, I feel sick.
Yes.
You say I shouldn't take antibiotics and it will go away in
By
10
itself.
to 14 days. What should I be doing?
So that's what I mean by it's supportive management. If you're an adult and you have a cold or a cough, and especially if there's no sputum or the sputum is clear, it typically is not. It's just an overproduction of the normal secretion because of the irritation. There's an irritation going on. You are sick, but the treatment for that illness is not antibiotics.
Okay.
Because of that assumption, that's why people tend to go and buy antibiotics, and then, like I said, it complicates the thing. So that finally, when you actually do need antibiotics, because you've abused the more common, cheaper options, we need to go to a higher, more expensive one.
Antibiotic.
In children, children are more likely to get treated with antibiotics because it's difficult to, first of all, the child will end up exposing themselves to some other infection as they play around, as they interact with other children. So sometimes in children we are a bit more liberal. We'll give them an antibiotic cover, especially looking at the circumstances. If the child is probably in school and everybody in the school is coughing, everybody in the school has, or one person in the school has a particularly infectious kind of RTI, we want to cover the next child so that it doesn't get there, So, but the bottom line is, let the professionals make that decision, because we will do the necessary testing to see if there's a need. If people, it's a bad practice that in Ghana our first point of call when we are not well is not the hospital.
The pharmacy.
Exactly. And you see, one thing I keep saying is that if you come to talk to me as a doctor, before you talk to me, you'd have paid. So I don't have any obligation to actually prescribe medication. So I actually give you an independent opinion. If you go to the pharmacy to talk to the pharmacist, he doesn't get paid for talking to you. He gets paid when you buy medicine. So don't be surprised that you are leaving your medicine. It doesn't mean that you need the medicine, but he needs to get paid. You see? So that's why we need to change that narrative and move our first point of call
to the doctor, to the hospital.
So that we can get that independent evaluation and then get the necessary treatment. If you have to go and buy the medication, then you can go and buy the medication. You see? So that's the thing. But you see, you have to juxtapose this upper respiratory, which is why I said mostly is the viruses, so most of the time we don't give antibiotics, to the lower respiratory tract, which are more commonly bacterial. So you have a pneumonia, you have a bronchitis, you will definitely need stronger medication, antibiotics, to make sure that you are getting fully recovered, you see. And the lower respiratory infections tend to be more serious or more severe than the upper respiratory. I mean, you have an upper respiratory and you're probably sitting here going about your duty. There might be a slight background headache, but it's not a big deal. But if you do have a lower respiratory infection, you probably be on bed shivering from a fever, severe headache. You probably cannot do anything. With chest pain. You see, chest pain. Even when you are breathing in, you get pain. So those are some of the symptoms.
Even the wheezing.
Exactly. You might get wheezing, but the wheeze is typically people who are asthmatic who get a superimposed infection. The wheeze gets even more severe. And in children, we also have something called bronchiolitis, which is
so bronchitis is different from bronchiolitis.
Yes, it is different because there are different branches of the respiratory tree. So at any point, basically, it's an infection. So anytime you hear itis, it's an infection of a certain region. So the trachea can get inflamed, even though we don't typically treat anything like that. Then the exactly, and the bronchioles are further subdivision, so you can get something like that. So it needs to be treated with a bit more urgency if it's a lower respiratory tract. So if this child is refusing to eat, is coughing very severely, has very high fevers, you need to bring that child in there. We'll do a chest X-ray, do a full blood count, see what's happening. If it's a pneumonia, you might even see fluid in the chest. Sometimes the fluid can get so severe that we need to actually go in and remove the fluid. You see, so it can be very, very severe. So in as much as they are common, it's not something that we want to play with and waste time, because it can have dire consequences, and we don't want to get there at all.
So when it comes to bronchitis, for example, does one ever get fully healed? Does one fully recover from it?
So, well, simple answer is yes. However, I know where you're coming from. There's a condition called chronic bronchitis, which can be quite difficult to treat, and typically would occur in, yes, children do get it on occasion, but typically occur in older people, especially people who have been smoking. So this is one of the reasons why we say you need to, don't smoke, because smoking can predispose you to actually developing
all kinds of smoke.
Yes, smoking is bad. It doesn't matter what you are smoking. Because once you
as long as you're inhaling.
Exactly, it's bad. You can make an argument for maybe a good side of whatever you are smoking, but the mere fact that you are smoking remember that even just sitting in Accra traffic, inhaling people's exhaust fumes is bad.
It's bad.
You see, so smoke going into your nose is not a good thing, period. It doesn't matter the source of the smoke. Once it's smoke, it's not a good thing at all.
Right.
You see, so smoking where you are now intentionally lighting something and inhaling is definitely even worse. You see, some of the cigarette companies try to put a filter at the base of the stick. But remember that when you smoke and you puff out, you still smoke. You still inhale what you've puffed out. So whereas maybe what you are pulling, I don't know how to call it, what you are pulling in may be slightly filtered. When you inhale and you take it back in,
some people say dragging.
Well,
so you drag.
So that's the thing about respiratory tract. And let me also be quick to add that I've spoken about the viruses and the bacteria, but they are not the only causes of respiratory tract infection. There are the fungi, there are the other things, and there's also chemicals, so some, or even allergic. And allergy can cause something that might be mistaken for an infection, but the difference is that allergic rhinitis would typically occur in the mornings, early mornings, because, so the general trend is that, when you leave home, your windows are open, dust settles on your pillow. When you come back in the night, you jump on the bed, whilst you are sleeping, you are taking in all the dust. So when you wake up, the centers have been triggered, so then the itchy nose, running nose is very severe in the morning, but it gets better in the course of the day.
By midday,
so that's typically how you differentiate between an allergic rhinitis against an infection. And there would also be other associated symptoms like itchy eyes, maybe itchy skin, so if somebody has...
I get itchy skin.
Exactly. So if somebody has that combination of symptoms, then you are leaning more towards an allergic reaction as against an infection.
Right.
But the fungi also cause infection. Then we also have the atypicals. Atypicals would include something like TB.
Okay.
Now TB is something that we don't see a lot of these days, but we still see, especially amongst people who have been exposed to persons who are immunocompromised. We tend to see TB in them as well, but in the general population, we don't see it as much as we used to see in the past, but it's still there, something that we still need to be mindful of. So if you have had a cough, for instance, and we've gone through the whole gamut of treatments, and I'm not talking about self-medication, you have gone through proper treatment, and it's not working. One of the options to now consider is TB. So you would request the TB test, and if it's positive, we'll take you through the treatment. The only difference that whereas your common cold the last 2 weeks, or your lower respiratory tract can be treated in a few weeks to a month, TB would require about 6 months of intensive treatment, you see. Yes, and one of the reasons why a TB treatment sometimes fails is that some people don't stay the course. So right now, the TB treatment is called DOTS, direct observation. So somebody actually go and somebody will sign that I watch this person take his TB medication. Yes, that's how serious we take TB, because and you see the TB germ is also very annoying. It mutates so fast. So if you don't complete your medication, the next time it's a different strain and requires. So we need to make sure that you're actually taking your medication. So somebody will actually take responsibility and sign a book. They will actually give you a log sheet. Have you taken your medication? Then somebody will sign. So we take TB very seriously.
Okay, so talking about new strains, right? Obviously, there's an emergence of new variants of respiratory viruses every day. How are you handling it? I mean, like the healthcare systems, how are you guys handling it? Because every day they say, oh, it has mutated. It's something new.
Yeah.
It's not more this. It's a new variant of COVID, a new variant of that. How are you managing it?
So let me let me just say that here in GH we are living on the grace of God. You know, he has been very gracious to us.
As with a lot of things.
Exactly. So yes, we are very thankful to him for the life he's giving us every morning. But elsewhere, I mean, I'm sure you hear of people taking jabs for the flu almost every year or every other year because of the rate of mutation. You know, so and that's how fast some of these viruses especially do mutate. You know, and it's because of the risk of cross-infection. So sometimes you might be infected by a certain virus, the common cold virus, for instance, and then you may be infected by a certain strain of the flu virus. Then they will cross-react and then create a different strain.
Is that what's happening inside us? Wow.
Yes. So the rate of replication is so fast that it's easy to integrate some of these changes. So then eventually they create a new strain, which now because the vaccine that was given last year was against a particular strain, the new strain is now resistant to that vaccine. So when there's an outbreak, then we need to get a different vaccine to now counter what the new strain is.
Yeah.
So elsewhere, almost every 2 years, they are vaccinating against a certain flu virus. But let me also be quick to add that sometimes the environment may also be conducive for that to happen. So that's why we don't get as many mutations here in our environment, you know, as occurs elsewhere. But let me also be quick to address this myth about sleeping in air conditioning or under fan and how it causes pneumonia. So in as much as sleeping under a fan would not cause a pneumonia, so that's the myth. It doesn't cause pneumonia. You know, in fact, it doesn't even put you at risk of pneumonia per se. If you have been exposed to somebody who has that pneumonia or somebody who has an infection, the person was coughing, the person was dripping, and the surface is contaminated, and you now inhale that into your system, that is how you get exposed. You know, then the cold temperature can then facilitate.
Okay.
So if you don't already have the exposure, you won't get it by sleeping in a cold place or for that matter.
Right.
But if you have already been exposed, then you put yourself at risk of, you know, the germs propagating because of the conducive environment you have created for them.
All right, Doc, thank you so much. Thank you so much. It was really insightful, you know, learning about respiratory tract infection.
Thank you.
Anyway, where can people reach out to you?
Well, I'm active on social media, Kelvin, also MD, and you can also follow our clinic page as well, Wireless Medical, on all social media channels.
All right. Thank you so much. All right, guys. So we've been talking to Dr. Kelvin Owusu, a wellness consultant at Violet Medical Center, and it's been all about respiratory tract infections. And if you watch this, I'm begging you, please take care of yourselves. All right, it's very important for you to take care of yourself.